Production funding is provided by A. Reddix and Associates, Health Information Resource Center, offering short-term training for long-term professional careers in medical coding. HIRCVA.net.
Discussing the issues and celebrating the successes of the African American community. This is Another View.
Hello everyone, I'm Barbara Hamley. Welcome to Another View. Recently, WHRO aired a documentary called Beyond Babyland. It was a sobering look at the high number of infant deaths in the Black community of Memphis, Tennessee. Now, nationally, for every 1,000 live births, almost 14 Black babies die before their first birthday. That's compared to 5.76 for white babies. Beyond Babyland made us wonder about the issue of infant mortality in the Black community of Hampton Roads. And while our numbers are not as high as Memphis, they are still of concern. Joining me to talk about the reasons for infant mortality in the African American community are Dr. Nicole Rankins, Assistant Professor of Obstetrics and Gynecology at Eastern Virginia Medical School, and Lily Smith, Coordinator of the Loving Steps program in Norfolk. Welcome, ladies, to Another View. Thanks for joining me.
Thank you for having us.
Now, we want to talk a little bit about the documentary and some comparisons and so forth, but let's get a basis for our audience. What exactly is infant mortality?
So infant mortality is death within the first year of life, and it's usually expressed as the number of deaths per 1,000 live births.
Okay, so the numbers for the African American community are significantly higher than the white community.
Yes, about 2.5 times higher, actually.
And even in the Hispanic community,
higher
correct?
than the Hispanic community as well.
Okay. So. Now, WHRO aired a documentary called Beyond Babyland, and let's take a look at a clip from it.
Every Tuesday and Thursday, as the bodies accumulate, the Memphis and Shelby County Health Department takes over for the families who can't afford a funeral.
The county off this service, and most people gonna take it because they do not have money to go to a private cemetery. We do as better job as we can because we getting those bodies back to God.
The county cemetery used to be known as Potter's Field. Now some people in the poor parts of town call it Babyland.
This is a great cemetery, and I have seen it over the years just explode with burying people.
And each of those little round circles represented a baby that died before its first year. Dr. Rankins, what's going on? Why do we know why Black babies seem to die more frequently than other races?
We don't. It's a huge area of concern on federal, state, local levels, and it's an area of research that we need to do more about. It's just not something that we understand, and it's multifactorial, as much as we know. It's not just medical, it's environmental, it's social, it's a little bit of, it's a combination of things.
Well, let's take a look at some of the numbers here in Hampton Roads. Lily, Norfolk has about the highest numbers in the area, doesn't it?
Yes, they do. They have 13.7%.
13.7%. As a matter of fact, we've got a graphic that's coming up. Virginia Beach is at 8.1 versus 5.7. Chesapeake is 17.8%. Portsmouth, 13.3. Suffolk, 9.8. Hampton, 13.7. Newport News, 11.1. All of those numbers significantly higher compared to the white community. Is there anything that's been able to be identified in the Hampton Roads area in particular that may be leaning towards this?
That's what I'm saying. Actually, those numbers are better. Those are the lowest that they've been in several years.
Wow.
So better for across the board for all communities. Mm-hmm. They've been as high in some areas as 20 per thousand, 30 per thousand. So last year was actually a celebration on the state level because the rate went down.
Because the number came down just a little
in Virginia. So that is good to note, but still much higher than what the goal is. With the national goal being 4.5 per 1,000 live births, we're way above that.
And the United States in general, though, is almost like third world countries in terms of the numbers of deaths that go on.
Yes, we rank very poorly internationally for infant mortality.
You work in the field, Lily. You're with the mothers on a daily basis, a frequent basis. You run a program called Loving Steps. Tell us a little bit about it and how you all help in this issue.
Well, it's called the Loving Steps Resource Mothers Program. And what we do, we take a multidisciplinary approach to addressing the problem. We have community health workers, as well as a nursing care coordinator, as well as a nutritionist who will actually go into the home and provide the clients with education and information referral services. We also provide transportation to and from their doctor visits and to other necessary places in the community where they need assistance.
So you're kind of helping on a sociological as well as a physiological, from a physiological perspective in terms of nutrition and that kind of thing.
Yes.
But Dr. Ranks, you look at it from both sides. I mean, is there something about black women's bodies, or does the research show that perhaps contributes to this?
No, when you look at the reasons about why infant mortality happens, so when you look in the white community, generally it's birth defects is the first reason, followed by prematurity and low birth weight, and then followed by SIDS, and then maternal complications of pregnancy like diabetes and hypertension. In the African American community, it's usually low birth weight and prematurity first, and then birth defects, and then SIDS. So the reasons are a little bit different. And when you also look at the numbers of, although it's death within the first year of life, when you analyze it, actually over half occur within the first 28 days of life. So a huge part of it is premature.
And I was going to say, is that because of premature births?
Yes, yes.
And do you find that that's because of diet or lack of prenatal care in time?
Prematurity is a really complex issue, and whoever fixes that is going to be a Nobel Prize winner. But prematurity, it's access to care and getting adequate prenatal care. That's part of it. Nutrition. Timely visits and follow-up, identifying issues early so we can intervene early, getting to a center like Norfolk General EVMS is what's called a tertiary center, so we take care of all the major problems in the area, and not all people can get here as fast, so it's a lot of different things that go into it.
Lily, do the women that you deal with, do they express a concern about either having a premature baby or their baby not making it to the first year?
Yes, we do have some clients that we get in, because we don't just accept clients who come in with their first pregnancy, but we have clients who have had pregnancies in the past who have been born prematurely, or they had a fetal death or an infant death.
What is that experience like for women who've had a fetal death? What do they tell you?
Unfortunately, some of them decide not to stay in the program because we get them prior to delivery. We try to get them in the first trimester of pregnancy, and once they've had a loss, they're at a loss because they can't identify with the worker anymore, because the worker to them represents the birth of the baby and the pregnancy and those types of things. And so they go into a depression, and they tend to withdraw from, you know, everyone, all of the other support systems that they have in place.
Now, the documentary looks at this issue from a poverty perspective, and I want to show another clip of that, and then we'll talk about it right after we see the clip.
I told Sierra, I said, I really don't have any money, but I'm going to get the money together. You need to have an abortion. You know, I don't want you to mess up your life like I did. And then this guy that you're dealing with, he's not going to do nothing for the baby. You know, he's not doing nothing for you now, so he's definitely not going to do nothing for the baby.
She told me I was getting an abortion, but I didn't want to get no abortion. So it was argument about that. She put me out and all that. I had to go stay with his mama for a little while. So basically, I was stressed out from a lot of stuff. I had to go to juvenile because my mama put me out. she said I ran away, so I had to go to juvenile. And she didn't want to come and get me unless I was going to get an abortion. So I had to tell her that I get an abortion so she can come and get me. And then when I got home, like some hours later, when I went to go use the restroom, blood clots was coming out. Real big blood clots, and I told my mama.
And we took her to the hospital, and the doctor stated that she had a miscarriage. Okay, so I was like, thank God, you know, and I don't wish that on anybody, you know, or whatever, but I just want her to have a life, you know, and she didn't know at the time that that would hinder her, because it's hindering me now. I tell them every day, I love you all, you know, and if I could go back, you know, I wouldn't have kids, you know, but I do have kids, and it's hard. It is hard out here.
Wow. So many different issues, and the stress that young lady was under. Her mother wanted her to have an abortion.
Right.
She didn't want. She's a teenager.
Right.
I would imagine all of those things could play into a miscarriage.
Absolutely, absolutely. And miscarriage is actually a little separate from infant mortality, because infant mortality deals with live births. So in the case of a miscarriage, it's not a live birth, and even that's a whole another issue in and of itself. Pregnancies that don't even make it to a live birth. That's a
so those numbers aren't even included in this.
No, no.
Wow.
No, they're not.
So from a social perspective, sociological perspective, young mothers who are having to deal with these types of issues, and I mean, that young lady's mother was really honest. She was saying, I don't want you to have the same kind of life that I've had to deal with.
Right. And we run into that quite often, where the parent is discouraging the child from carrying through with the pregnancy. And a lot of times it prevents the young ladies from even exposing the fact that they are pregnant. And that becomes a problem because it reduces their chances of seeking prenatal care. And so then you have one problem on top of another problem. And so we tried to even, one particular client, we had to help her and encourage her to even expose that information to her mother before she actually started to show. You know, she wanted to have the baby, you know, because she was in love with the young man that she had gotten pregnant with, but she couldn't tell her mother. She was afraid. And we even have that in some adult situations where the woman is a little bit older, but she still lives in her mother's household or family's household, and she's afraid to tell the mother. And so it just becomes a snowball effect. You know, they refuse to go to get the medical treatment that they have, or to even seek benefits such as WIC or Medicaid and things of that sort that would be able to help them.
To be able to hopefully have a baby that they can carry to term and that's born and that's healthy. But Dr. Rankins, this is not necessarily a poverty issue, is it?
No, no. Like my risk for infant mortality as a college-educated African-American woman is about the same as a high school educated white woman. So it's not that education confers a better advantage for me. I'm still at a disadvantage just by virtue of being African American, and that's something that we can't figure out.
So do we know, I guess I'm still trying to grapple with then what makes us unique in this issue? I mean, is there anything that research is showing, because I know you're the head of the Infant Mortality Task Force at EVMS, and what are you all doing in terms of trying to wrestle some answers with this issue?
Right, this is something new that we started within the last year or so, and it's a multidisciplinary effort between me as an OBGYN, pediatricians, the dean of the medical school, the community people, to try and put our heads together and address this issue, because we're not going to solve it sitting in our offices and from a medical perspective. We have to have a social perspective, government perspective, someone from the health department there too as well. And there's some evidence that there's something about race that we just can't quite figure out. Even if a woman thinks she's experiencing racism, whether or not she is or not, that she's at a higher risk for having problems with mortality or pregnancy complications. It's a really complex issue. Stress is something that plays into it as well.
What about things that you had mentioned before, like diabetes, high blood pressure, those things that run in our community anyway? I mean, every disease pretty much runs in our community, but but those issues in particular, I know are things that you want to monitor as while you're pregnant. Do they play a role?
Actually, we need to fix those before women get pregnant, because to some degree it's almost not too late, but it's harder to address the issue once someone is pregnant. The best thing we can do is optimize people's health before they get pregnant, and that's just not something that we do a very good job at. So.
And there's a program that Spike Lee's wife started.
Yes, A Healthy Baby.
Yeah, Healthy Baby. Tell us the name of it again.
A Healthy Baby Begins with You.
Yes, A Healthy Baby Begins with You.
She actually came to EVMS to talk about it.
And their whole point was to try to get men and women to start to take care of their health. Lily, you smiling over there.
I am, because you have to include the male in this equation. You can't exclude him and just think it's a woman's problem, because it's not. You know, the loss of a child affects every member of the family. And regardless of whether it's a cohesive family in terms of being married, or whether they're living together, or whether they're just dating, you know, it has an effect on each member. And to be able to educate men as to their role in this whole complex issue is just so vitally important.
Is there anything medically that, I mean, could there be a gene or a enzyme or a
people have
something?
People have looked at genes, people have looked at blood factors, like you said, enzymes, whether they're hormones that can be affected by it, but there's nothing that stands out.
Nothing that stands, either from the male or the female?
No.
So what do we do about it? How do we try to at least give people a fighting chance?
Well, I think talk about it is the first thing.
Okay.
I wasn't even aware, and I did training in health disparities at excuse me, UNC Chapel Hill, and I wasn't even aware that infant mortality was such a huge disparity. I grew up here in Hampton, born and raised, and my mother said the same. She's like, "What? I didn't even know that this is."
Exactly. I was surprised also.
Right. So I think the first step is just getting people aware of the issue, and then also we have to involve multiple people and try to get different heads at the table to think about it, and to devote time to it as well, and money.
Money always, absolutely. Lily, from your perspective?
I believe getting the parents involved in the health of the child, as you said, prior to pregnancy, even prior to middle school and high school, to make sure that the parents are involved with the child on a daily basis, communicating with their child things about taking care of themselves. And it has to be a refocus on how we eat and how we live and those types of things, and then that passes on to our children. You know, until we do something at the parental level, then the children are going to do what they see, because they're going to copy what's being done in the home. And so,
well, I was going to ask you, Lily, are we talking to our young kids early enough and often enough about sex and about the ramifications of it and what's involved should you get pregnant?
We probably are as
a
the
community.
Institutional wise, but in terms of what we're doing in the home, I think we're doing a terrible job. I think we're doing a terrible job, and we're doing the children a misservice.
Is that because as a parent we don't know, or is it? I know that there's always been that stigma of, you know, when do I talk to my child?
It's hard. It's a hard decision. It's not easy to say, because you don't want to appear as though you're encouraging sex because you're bringing up the topic, but it's something that we need to think about. So the program with Tanya Lewis-Lee, A Healthy Baby Begins with You, is a preconception educators program, and it takes students and they educate other students about being healthy preconceptually. And what it does is it tries to say, these are the things that you can do in order to have a healthy pregnancy. Now, that's a hard message to tell a 17-year-old something about pregnancy, because you don't want to appear like you're encouraging it.
Sure.
So, but we need to address it, because we need to do something, obviously.
Do we have a Babyland here in Hampton Roads?
Not that I'm aware of.
Thank goodness.
Not that I'm aware of.
You know, because even though our numbers are really high, I'm looking at and again, the Memphis documentary really talked about from a very from the poverty level
Right.
of the people who were involved and those who
Right.
couldn't afford funerals and
Right.
and so forth. It was a very tough documentary
Right.
to watch
Right.
because of those issues. But
Right.
I just wonder, with our numbers being as significant as they are,
Right.
if people here face those same types of issues, what do you see when you're in the community?
I've had the privilege of attending what's called When a Baby Dies. It's a workshop that's been held through the Eastern Virginia Perinatal Council. And what happens a lot of times is that those babies are cremated when you have families that don't have the funds or whatever the means to pay for an official funeral or anything like that, that those children are disposed of by cremation.
So now you have resource mothers. These are professionals?
They're lay workers, but they're
Okay.
trained to use a particular curriculum called Partners for a Healthy Baby. It's a research-based curriculum through the Florida State University. And we use that curriculum as well as we receive continued education, professional education.
And they go out and work with, I guess, have caseloads or
Yes.
numbers of women that they work with. And they talk to them about everything from nutrition to doctor's visits,
Yes,
etc.
they do. Yes,
Mentoring.
they do. There are several types of screening tools that we use to assist them as well. We use the Edinburgh Depression Screen to determine those women who are at high risk for having depression, and we of course refer them to the Community Service Board and other mental health facilities in the area. We also conduct, once the baby is born, we do conduct the ASQs, which is a developmental screen, you know, that we do for the children once they turn 4 months old and older, so that we can refer them. So we do provide all types of education. We provide all types of services. They're called lay health workers. Community health workers is the new term that they have for everyone now. And so, but it goes so much further beyond than, you know, when you think of lay.
Right. Yeah, you think of somebody who's not necessarily trained in it, but they are very
these
trained.
young ladies are very well trained.
Okay. And Dr. Rankins, if we've got less than 2 minutes, what do you want to say to, particularly to African American women, African American families, in terms of preventing infant mortality?
I would say think about it before you get pregnant. Try to plan your pregnancy as much as you can. Optimize your weight, your nutrition. Make sure you're taking a prenatal vitamin at least 3 months before you want to get pregnant.
Really?
Yes. And just educate yourself. Be your own advocate. Look out for yourself. Really, education is a big part of it.
Okay. And Lily, what would you tell them?
That if you find yourself that you are pregnant, please, there are different programs in the community. Please give us a call.
And do you have to be, can you be of any income level, any sociological level, or socioeconomic level, I meant to say?
Right.
Or is this just for lower income, or what?
It's for anyone. Who's pregnant and who live in the city of Norfolk and who feel like they need that extra support.
And there are resource mothers programs throughout all of the cities in Hampton Roads, is that right? Or if you live in a different city, can you come?
I'm most familiar with Norfolk because this is where we work, but the best thing to do would be to contact your local health department, and they can tell you about resources that are available.
Okay. Ladies, thank you so much for joining us. A tough topic, but a necessary topic for us to talk about. And we'll be right back after this look at what's happening in Hampton Roads. weeks ago, we talked about foster care on Another View, and we heard from several of you wanting to know how else to help outside of becoming a foster parent. So here's a suggestion. Participate in the second annual Mentor 5K Run Walk at Mount Trashmore in Virginia Beach. The walk happens on Sunday, September the 19th, and all proceeds will benefit the Foster Care for 2010 campaign, a campaign designed to help foster kids who are about to age out of the system get the skills they need to successfully transition into independence. The Run Walk is sponsored by the Together We Can Foundation and the Hampton Roads chapter of the Conference of Minority Transportation Officials. You can pre-register by visiting compto.hr.info. And that's our show for this evening. Next week, our roundtable pundits discuss the use of the N-word. And you know that's sure to be a lively discussion. We'll see you next time for Another View.
Production funding is provided by A. Reddix & Associates, Health Information Resource Center, offering short-term training for long-term professional careers in medical coding. HIRCVA.net.